First question. Social sign on the X-ray is a suggestive of. First option is rotator cuff arthropathy, calcific tendinopathy of supraspinatus, slap tear, or last option is shoulder instability.
So as we talked about, this is also a question from last time. Uh, so we there was some controversy, and we thought that we'll just come back again to this question. So I had suggested that there was a confusion between option A and B. So rotator cuff arthropathy or calcific tendinopathy of supraspinatus. Uh, the ideal answer actually is the impingement sign because Sourcil sign. What is Sourcil sign? Can you explain, Yogesh? Any idea what is Sourcil sign?
No, sir.
So Sourcil sign is also seen in osteoarthritis of hip. So there is sclerosis of in osteoarthritis of hip. It's the sclerosis of your supralateral part of the acetabulum, which is the first sign of actually your osteoarthritis of hip. Similar to what you see as subchondral sclerosis, which is the first sign in your knee osteoarthritis. So Sourcil sign is seen in impingement when there is more external impingement syndrome. Your under surface of acromion, you see sclerosis there. That is called the Sourcil sign. Sourcil refers to eyebrow, so it's the eyebrow sign. But impingement syndrome is not an option here. So there was confusion that calcific tendinopathy of supraspinatus can lead to impingement syndrome. So should that be an answer? Or rotator cuff arthropathy, should that be an answer? Rotator cuff arthropathy is a broad term which incorporates impingement syndrome and later stages of cuff tears and which later on leads to your rotator cuff arthropathy. So it is, you can say if we go to needs stages of impingement syndrome, it describes as stage 1 as impingement, stage 1 and 2 as impingement, and stage 3 as cuff tears. And the progression of that would lead to a cuff tear arthropathy. So a better answer from these would be our sources sign would be a rotator cuff arthropathy. Why not calcific tendinopathy? Because in calcific tendinitis, you will see other things like you will see, especially in chronic stages, you will see calcific deposits there. You will see on X-ray calcium deposition in your rotator cuff. So you'll see which is a better indicator of your calcific tendinitis. So out of these four options, if I have to choose, I think we should go with A.
Okay.
Okay.
Yes.
Any confusions from anyone? Okay, then we'll go on to the next question. So the answer should be rotator cuff arthropathy. Okay, let's take this question.
Second question. A young male was given interscalene brachial plexus analgesia for orthoscopic Bankart repair for recurrent shoulder dislocation. In the post-operative period, analgesia was maintained with a top-up of 0.2% BPOACN every 8 hours through the interscalene catheter. During the post-operative round, he complained of facial discomfort. His picture is given below. True about the diagnosis and treatment is first option A, facial nerve palsy, give IV steroid. Second option, Horner syndrome, remove the interscalene catheter. C, dry eyes, artificial tear. D, option D is facial nerve palsy, stop BPOACN.
Hmm. So, any idea what is going on? Any guesses, Dr. Yogesh? And please,
Uh,
anyone, please don't answer in the chat box. If you want to interact, please interact. Come on the mic and interact with me. No answers in the chat box, please. Yes, Dr. Yogesh.
so this will be the Horner syndrome.
Yes, very good. Why do you say it's
Yes.
Horner syndrome? What is the triad of Horner syndrome?
There is anhydrosis, ptosis, uh,
And
drooping of
meiosis.
eyelids, and meiosis.
And meiosis. Yes. So
Yes.
you can see
Yeah.
that there's marked difference on both the sides. And Horner syndrome is a very common complication with interscalene block. It can be, studies have reported as high as 30 to 40%.
Okay.
So it's not that uncommon, but usually there is no long-term deficit. It's just as soon as the effect of the drug wears off, the patient is okay. Okay, so you just need to take off the drug. There's no long-term deficit in these patients. Okay, so because there's continuous top-ups being given through the catheter, if you stop giving the top-ups, the patient would be cured of his symptomatology. So answer should be B, Horner syndrome, and we should remove the catheter. So Horner syndrome is a triad. We know triad of ptosis, meiosis, and hydrosis, and it has been shown as at 4 to 37.5%. As high as that, there's a chance of development of Horner syndrome, but there's no long-term deficit. As soon as the drug wears off, the patient's symptoms also wear off. Okay, so next question. Yes, anybody else
Yes.
except for Dr. Yogesh who wants to interact?
Mm,
There was somebody who was interacting in the chat box. Does he want to come and interact?
Saurav Lal Das, sir.
Dr. Saurav, do you want to interact? Yogesh, you can go on.
Okay, question number third. Which muscle is being tested by the examiner in the figure? Option A is supraspinatus. Option B is infraspinatus. Option C is teres minor. Option D is subscapularis.
Yes. So which test is this? Any guesses?
Liftoff test.
Yes. Who is this?
Sarana Kumar.
I didn't get you. Who is this? Doctor?
Sarana Kumar.
Okay.
Saravanan.
So, yes. So which is this lift off test? Which muscle is
This
being tested? You're absolutely right.
first subscapularis.
Yes. This is subscapularis. You're absolutely right. Do you know any other test for subscapularis? Any other test you know for subscapularis?
Belly press test.
Very good. Can you give me one more test? Very good. You're absolutely right. You're on the right track. So subscapularis, the two most common tests which are done for subscapularis are your lift-off test and the belly press test. The most newest test which was described was the bear hug test.
Beer.
Bear hug test. So this is the lift-off which was being tested. There's a bear hug test and there is a belly press test. So this you take this is clearly your lift-off being tested. Lift-off is a very good test, especially for upper fibers of subscapularis, and all the tiers of subscapularis begin in the upper fibers. So it is a very sensitive test. But problem with lift-off test is that you have to take the arm behind your back, and if there is some associated stiffness or internal rotation is associated with pain, the patient may not be able to take his arm behind his back. So easier test to do is a belly press test. But problem with belly press test is that it only tests the lower fibers of subscapularis, which are involved very late in a subscapularis field. So to mitigate these problems, we have a newer test which is called the bear hug test. Bear hug test also tests for upper fibers of subscapularis, so it's more sensitive as compared to a belly press. So if you ask me which are the best tests for subscapularis, your bear hug test is one of the best. Then your lift off, and then your belly press. Okay. Dr. Kumar would like to take the next test or the next question also. This is an easy one.